Welcome, everyone. Thank you for joining us today. I'm Theresa, Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Overall, 14,180 individuals have been tested for COVID-19. Currently, we have 992 tests that are pending. For those of you who are awaiting test results for COVID-19, please check the Ministry of Health's online portal or the link on our website. Please remember that while you are awaiting your results, you must remain in self-isolation. I will now share the most current case counts. There are 78,072 confirmed cases of COVID-19 in Canada and 22,957 cases in Ontario. Chatham-Kent has 137 cases and Sarnia-Lambton has reported 225 cases. Michigan now has 51,915 cases, with 10,368 cases being in Detroit. Today, we are reporting 794 cases of COVID-19 in our community, an increase of 11 cases from yesterday. 37% of our cases have occurred in long-term care homes and retirement homes, including both residents and staff. 453 cases are now resolved. 22 people are in hospital. 17% of our cases are between the ages of 20 and 29. 15% are between the ages of 30 and 39. 15% of our cases are between the ages of 50 and 59. And 19% of our cases are 80 years and older. 43% of our overall cases are male and 56% are female, and 1% is unknown at this time. Our community has lost a total of 63 people to COVID. 47 deaths have occurred among residents in long-term care and retirement homes. Our health unit is working with 17 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Testing should be considered even if you have one symptom. Common symptoms of COVID-19 include fever, a new or worsening cough, shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Health Center, Healthcare in Leamington, and Windsor Regional Hospital, Olette Campus. Please note that testing is now available for people who have even one symptom of COVID-19. Please continue to visit wechu.org for the most current information and case counts. And I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. I hope all of you practiced physical distancing and followed all the public health measure recommendations during this long weekend. Please continue to follow these recommendations to protect yourself and your family members. Today's briefing might seem a bit different because what I'm trying to do here with a lot of help from my team is to try and answer a question that is raised consistently. I understand some of the rationale that we use in making public health decisions are too complex and technical, and it may not be as simple for everyone to understand. As we are fighting this pandemic together, it is also very important for all of us to have a basic understanding of some of the key concepts in communicable disease control from a public health perspective. So very quickly, these are the questions that I'd like to cover today. What does testing mean for COVID-19? What types of tests are available in Windsor-Essex? Who should get tested? Why not test everyone? When someone should get tested, and is there any harm in getting tested when a person is not currently infected? Before I answer all of these questions, I would like to quickly talk about chain of transmission and process of infection and the spread, and how we can protect ourselves and minimize it. The virus that caused COVID cannot survive outside of the body, and it requires a human reservoir to survive and multiply. Inside the human body, the body fights against the virus and develops antibodies. Before the person recovers from the illness, the virus desperately tries to find a portal of exit to leave the body to find a new host. Since the virus that caused COVID lives in the upper respiratory tract, and more specifically lives in the behind our nose and throat area, it can only leave a body when a person coughs or sneezes, or when a person touches their mouth, nose, or eyes. When a person coughs, this virus attaches itself to very tiny water droplets and exit the body in the form of these droplets. That is why we say that this virus is spread through droplets. These droplets do not travel that far and tend to fall down immediately, not more than 2 meters. That is why the physical distancing of 2 meters came from. And on the same note, if a person who's sick with COVID, and if they wear a mask, that droplet cannot travel far and either get stuck in the mask or barely make it through. Once outside the body, these droplets tend to land on individuals and gain direct access to a person's mouth, nose, and eyes to infect them. In some cases, the infected person, after touching their mouth and nose, then touches another surface or touch another person, that is, shake hands. The virus is then transmitted to another host. Indirect transmission through touching a contaminated surface also happens in the same manner. Now, the person who just got exposed to the virus need to bring this virus to their mouth and nose or eyes to bring the virus inside their body, and the cycle continues. What we do in controlling these infectious diseases is we break the chain of transmission at each of these steps. If we can completely get rid of the virus or eradicate the virus from this world, then we don't have to worry about this virus at all. But unfortunately, that is not happening, at least in the near future. That is the reason we always will have a human reservoir, and we need to ensure that these humans are identified early before they spread it to others. Through aggressive case and contact management, we not only identify those who are sick, but also identify others who may have been exposed, and if all the contacts who were exposed are in self-isolation, and even if they develop disease, then they will not infect others. Public health goal is the early diagnosis and isolation of all those who are exposed, and continue to be the most important measure to contain the virus. If that fails, we ask people to stay home if they're feeling sick, or use a mask when they are sick to not let the virus leave the body. If that fails, we ask people to follow appropriate respiratory etiquette, wash hands frequently, and avoid touching mouth, nose, and eyes to break the chain of transmission. And even if that fails, if the virus gains access to the body, we need a vaccine to protect ourselves. Unfortunately, we don't have a vaccine at this point, so everyone will get infected and show symptom of disease, and in the absence of any antiviral medications, the virus will continue to replicate until the body develops antibody against it, and then the cycle continues. As we can see, the most important public health strategy, especially in the absence of a vaccine or treatment, is controlling the virus spread and containment. In order to do that, we need to have a healthcare system that is prepared for early diagnosis and early detection of contacts, and isolate individuals to prevent further spread. The Windsor-Essex County Health Unit team is already doing an aggressive case and contact management and has significantly reduced the community spread. However, we are still having cases in our community, and it highlights the need for ongoing education and protection for our community. What I worry the most is the false sense of security that many of us want to feel. We all want to believe that we got this. We got it under control. I want us to be realistic on what is happening, what these public health measures mean, and how we will break the chain of transmission for COVID-19 to protect our community. So now the next question is, what is the importance for testing for COVID-19 and what is needed to ensure that we have the testing capability in our community? We already touched on the importance of testing in the previous slide. Since the beginning of this pandemic, public health is working really hard to identify cases early and isolate them to limit their spread. In order to achieve that goal, we took a number of measures. We worked with all our healthcare system partners to ensure that we have the assessment centers up and running, build capacity within the healthcare providers to collect nasopharyngeal swabs, ensure availability and distribution of nasopharyngeal swabs in the community, worked with the labs to ensure a good system is in place for shipping specimen and getting the results back. We worked really good on it, and despite some challenges, we are in a stable position, but we need to build that local capacity more to make it even better, to test more people and get the results back quickly. However, I don't want to overemphasize the value of testing and want to be very careful in understanding what are the risks and benefit of testing and the appropriate use of testing based on these risks and benefits. In Ontario, right now, we only have a PCR-based testing using nasopharyngeal swab. We do not have point-of-care testing or antibody testing available in Ontario at this stage. When we talk about the type of test, we can classify them as either a diagnostic test or a screening test. And let me explain each. A diagnostic test is designed to confirm the presence or absence of a disease. It is commonly used to detect infectious diseases. The purpose of this test is diagnostic and is not preventative in nature. Testing individuals does not alter the course of disease. It is a test that is in point in time, and having a negative result does not mean that the person is safe. Nasopharyngeal swab for COVID-19 is a diagnostic test, and it is not a screening test. The other type of test is called a surveillance test or a screening test. And these tests are designed to identify the risk factor for a disease. And it's commonly used to screen for chronic diseases and not for infectious diseases. Purpose of this test is to identify risk factors so that we can prevent or delay the onset of chronic disease in high-risk individuals. It allows individuals to consider modifying or changing their behavior to prevent or delay the onset of chronic diseases. Having a negative screening result could mean that the person has a low risk for developing chronic disease. When we are talking about nasopharyngeal swabs for COVID-19, it will not identify the risk or future likelihood of contracting COVID-19 because everyone is at risk for contracting COVID-19. Now, the next set of question is, when we talk about who should get tested, why not test everyone? And when should someone get tested? I would like to use this slide, the next slide, to explain as much as I can to help everyone understand the nuances with and the timing of tests and its value. If you can see along the blue line, this is the continuum or a timeline for when a person do not have COVID-19 and then they get exposed. And if they contract the disease, they develop symptoms and go through the disease process before their symptoms are resolved. And once the symptoms are resolved, the body completes its fights against the virus, and they are considered to be no longer infectious or resolved. We know that the incubation period for COVID-19 could be up to 14 days. And once the person starts to show symptoms, they can be infectious up to 14 days. Based on that, we can choose various time points to test individuals, and I'll try to explain what the testing will yield. One thing to remind you, all of you, is that the current available test for COVID-19 is, again, it's a diagnostic test and it's not a screening test. It can only confirm the presence or absence of the virus that caused COVID-19. If we test someone before the exposure using this available test, the result will be negative, and that is all it can tell. The same person could have an exposure the very next day or very next moment. And so testing anyone proactively will not give us any real benefit other than confirming that on that specific timeline, the person was negative. Okay, so now the person is now exposed, and we understand that it could take up to 14 days for the person to show symptoms. And if we are testing someone immediately after the exposure, the likelihood of the nasopharyngeal swab coming back positive will be low, probably due to low viral count. And if the result is not interpreted with caution, it could easily make someone believe that they are negative and they are safe, which is not true, because they would still go on to develop the disease because they are already exposed and the virus is still incubating in their body. And then once the person starts to show symptoms, that means that the viral load in the body is high enough, and the nasopharyngeal swab can definitely confirm the presence or absence of the disease. That is why the best time to interpret the result of any diagnostic test is to test when the person have any symptoms. And as you heard from Theresa, that right now we want people to get tested even if they have one symptom. Go and get tested so we can have a better understanding of what is happening in the community. Since the nasopharyngeal swab, PCR, is a diagnostic test, we want people to go and get tested. If we are testing someone once the symptoms are resolved, we can still get a positive test, and if that result was already not known, it can still be beneficial. But if the person already know the result, doing a repeat test can still bring a positive result for up to 4 to 6 weeks. But it does not mean that the person will continue to be infectious for that duration of time. We have good research evidence to suggest that most people will clear the infection within 8 to 10 days since the onset of their symptoms, unless they were really sick and required hospitalization. Lastly, if the case is resolved, the nasopharyngeal swab can give us a negative result, which will not tell us if the person was previously infected or not. And the best test to do at that time is to use the antibody testing, which we do not have at this point. So now the question is there any harm in getting a test done when a person is not currently infected? These are the reasons. It gives a false reassurance to individuals that they are safe and could lead to risky behavior and not taking public health measures or precautions. It shifts attention away from prevention. Right now, the best way to protect yourself from COVID-19 is prevention. It's not testing. You have to be really clear about that, we need to pay our attention to the prevention from contracting the COVID-19 in the first place. Testing a lot of people is resource intensive with no real protection for the community. We want everyone who is symptomatic to get tested so we have a real understanding of what's happening in the community. Testing people before their onset of symptoms can only be beneficial if it's repeated after every few days, which is practically impossible for anyone to have that done in our community. So let's stop at this stage, and I hope that this gives some food for thought for people and help understand some of the rationale that we use in public health.
Unmuted.
We'll now take questions from the media. We'll start with Blackburn.
Yeah, I just wanted to clarify the new testing criteria. This when somebody only has one symptom. When did you start testing people for that? And maybe just reiterate why that's important now that you're testing everybody.
So we do have a good number of assessment centers available. We want to get a better handle on what is happening in the community, and we want to set up a low threshold so more and more people can be tested. When we are testing more and more people even with mild symptoms, we will have a better understanding of how this disease is progressing in the community. And if we really want to do a good job in case and contact management, this is what we need to do. And we need to identify those people and put them in isolation and identify their contacts so that they do not continue to expose other people. And this has been much more important because right now, as we are seeing the low positivity, person positivity of the people who are going to the assessment center, we want to make sure that we are testing enough people even with milder symptoms, and that would give us a better indication of what's happening in the community.
Isn't it like allergy season and things like that right now? I mean, have you given people an idea of maybe the symptoms they should really be looking out for and not maybe some typical symptoms?
Well, the complete list of symptoms are there, and we know it's on our website, and people can go and check that. Even the test that we are, the self-assessment tool, it identifies all those symptoms. And even when people are having any of those symptoms, they need to get to the assessment center. They need to get to their connect with their primary care providers. They can do a virtual assessment, and that would give them a better indication of where they are. Because right now there are a number of things that could be happening. It's an allergy season as well, and many people may have symptoms related to allergies, which could mean that they are not infectious, but if they require testing, then testing can happen, and that's what we want to rule out anyone rather than people thinking that they may or may not have it. If they have the symptoms, we are encouraging them to get tested.
Any questions from CTV?
Easy question. Why the push now for more testing?
Well, for a couple of reasons. We have now better lab capacity, at least that's what we have heard, that we have got good lab capacity. And the second piece is, as we are opening up more businesses and retail stores, the likelihood of people coming in contact with each other would be high. So if we want to get a good handle of how this is impacting our community, we need to set a low threshold so we can easily mobilize our resources and our public health work. All the good effort that we have seen so far in terms of reducing the community spread is by taking all those measures. So now when we are scaling back some of those measures, we need to know how this will impact the community in general. And that's the best way to do it, that if people are even having mild symptoms, if we are testing them, we'll have a better handle on what's happening in the community.
Do you feel up to this point that people have been shrugging testing off? Like you say, I have an allergy or, I have a little sniffle, I'm not going to bother getting tested. Those are the people you still want coming in no matter what, so don't be shy.
Well, I guess, again, it really depends on the health assessment piece as well. What we have seen all kinds of, the human behavior is very interesting. You can see all the extremes. There are people who, even when they don't have anything, they still want to get tested. And that's why I think the whole purpose of my presentation is to give a good understanding of what does it mean. And then on the opposite end, we have people who are, even when they're sick, they don't want to get tested because of reasons or concerns that now, even if they don't have the infection, if they go to the assessment center, if they go to their primary care provider, then they might be exposed. So we have people like those as well. And I think it's just a matter of understanding and having a good handle on what does it mean, and if you have a risk, then yeah, of course, if you are going outside, if you're connecting with people even just by going out to groceries, if you develop symptoms, there's a possibility that you might be exposed. But if you never went outside of your house for, let's say, 14 days or 21 days or a month or 2 months, and you haven't come across with anyone, the likelihood of you having COVID would be very low. So I think it really requires that level of discussion and assessment with either at the assessment center or with your care provider or through virtual assessment to identify your risk. But we want people who are out there, who are getting exposed, and if they are developing any symptoms, we want them to get tested.
One more, sorry. I know we've talked a lot about the second wave. Do you suspect that at some point it could happen, and do you expect to see those numbers in the next little while? Because I know the testing's kind of been lagging, in results. So do you expect that to happen if it does happen later this week or early?
I do about that, because even if what we are learning from the history is, if you recall the Spanish flu in 1918, the second wave was much bigger and much more deadlier than the first wave. So we need to be very cautious when we are opening up these restrictions, that people need to understand it's not over. The virus still exists in our community. And so yeah, to answer your question, it is still a strong possibility that it could happen. It's only up to us as individuals and as the community that how bad or how it would look like. And the result may not show up in the next couple of weeks. I think it would show up maybe 3-4 weeks down the road, because it takes some time for a critical mass to get infected, and then if people are not following the precautions, then they will be able to infect other people, and then it can start spreading back in the community in numbers, which could pose a significant risk to the community. So when we are talking about all these loosening up of those restrictions, we need to be very careful in looking at all these numbers, and how, as a community, we need to react to have a minimal spread or to contain it as much as possible. And so just be mindful, anyone who is watching, it's not over. The disease still is out there. The virus is out there. We still need to do everything that we were doing before to keep the virus contained and keep our community safe.
Any questions from AM 800?
You mentioned that people with one symptom can now get tested. Will that not also increase the lag time waiting for results?
Well, we are seeing the results are coming back quickly than before, and we have had several conversations with the labs, and the expectation is it will continue to get better. So we are counting on it, and we're hoping that all this will help us. But we also need to recognize that some of the lag time was because of the mass testing we did in the long-term care home, and now that part is done. We want to make sure that our assessment centers are using all their capacity to test these individuals. Also, we want our primary care providers and other healthcare providers that we initially work with to test more and more people if they meet the symptoms or if there's suspicion of COVID. So we want to ramp it up to make sure that we are getting more of those people who are symptomatic and who can benefit from having the test done. So a combination of those two, I think that we will be getting the results faster, and it would give us more detailed information of what's happening in the community.
So if I get tested today, when will I get the results back?
The expectation is we should get the results back in 24 to 48 hours, and that has been the case with some of the people. And we also need to recognize that it's not just the test that's delayed; it's the reporting and some of the paperwork that gets delayed as well. But again, it's we have come. Our system has got better, and the hope is it will continue to get better.
During your presentation, you said several times that testing can give a false sense of security because if somebody comes back negative, then they think they are safe and can go out. So what's more important, testing or physical distancing?
Physical distancing, we have always said that right from the beginning, that the physical distancing piece is the most important measure. Staying home when you're sick is the most important measure. The testing only gives us an answer if someone is having symptoms, whether they have the disease or not, and if they need to just completely self-isolate themselves from others to protect everyone else, even from their own family. We know that when someone is out there and if they're doing physical distancing, maybe they're not affecting others, but if someone gets sick and if they're not maintaining their physical distancing even with their family, that could be a challenge, that could be a problem. And I think that's why the importance of testing is important in the communities as a community aspect. And then the other fact is the testing is important is to identify people who may get really sick, and if they require any hospitalization, what does it mean? Because we know with COVID-19, if someone is infected, they can easily crash very quickly. So the moment that they got infected, within a matter of day or two, their respiratory system can collapse, and they need to be in ICU or put on ventilator. Having a positive test, it can just expedite that process, that people are not guessing that what is happening, and they can be prepared. So there are some key people who can benefit from having the testing done, and so testing from a public health side and the community side It will help us to diagnose cases early. It will help us to diagnose, to identify contacts early. And once they are all identified, we are limiting the spread in the community. From the acute care side, or from a health need side, it would help us to identify people who need more care or more intensive care as needed.
Thank you.
Any questions from Windsorite?
Yeah, you mentioned we have increased lab capacity. Sunday marked the first time in our daily pending test number dropped below 1,000 in about 2.5 weeks. Is that due to increased lab capacity, or is it that we're testing less?
It's a combination of both. And as I said, that there are a number of new processes that were put in place to help us get the specimens to the lab appropriately, and having the lab ship those specimens to the lab that is doing those mass testing and also some of these immediate testing that's needed. So there are a number of measures that took place last week, and the hope is it will continue to get better.
Any questions from the Windsor Star?
Dr. Ahmed, over the weekend, some new recreational venues reopened for the first time in months. Golf courses, marinas, and park areas. And some retail is going to begin today, and people returning to the workplace. Are you seeing any specific behaviors in the local community that are concerning you?
Good question. We haven't received any specific complaints about all these new changes, the businesses and others that are opening up. We did had our some of the businesses and the retail stores are opening today, so we'll have to see how that impacts the community. And we still need to make sure that people are following the public health guidance, especially physical distancing piece, and the store owners are also limiting the number of patrons in the establishment based on the guidelines. And we will be doing some proactive follow-up on these. Either we get a complaint or just going there to see all these business establishments and how they're operating. So we will have a better handle after seeing how these businesses are operating, and we like to take the education-based approach to tell some of these businesses, because they may not be even aware of how to achieve that some of these public health recommendations. So we'll take that approach, and we'll work with every businesses to develop good standard operating procedures to protect themselves, their employees, and also the visitors that are going to these facilities.
What's the health unit's position on public reporting of these sort of concerning behaviors?
Well, it's very difficult and challenging to confirm if someone is following a public health measure or not. And I think we all need to take up the responsibility. As much as I can say that, yeah, we should be targeting them, but there's no way without invading person's privacy and getting their personal details before we can even comment that if someone is infected or not and whether they were following that behavior or not. But I think we all need to be aware of our own responsibility. It's a community's responsibility. Everyone needs to step up and do their part. And as much as everyone is doing it, we'll all be safe, and that's what we want.
Thank you.
Any questions from CBC?
Yes, Dr. Ahmed, another reason for the way we were testing previously was that you had said before that there wasn't enough swabs and other supplies for testing. Is there just more now, and that's how we're able to do this?
Yes, I think that's something that we have heard from the ministry as well, that the labs are getting these swabs regularly. They were using these swabs and conserving it because there was no supply coming. What we have heard is that there's a steady supply of swabs coming into the lab, and again, unless we are doing mass testing of thousands and thousands of people, we are in a position, but those capacity from a lab perspective is reviewed every couple of days to come up with a plan for the next week or so. So right now we haven't heard any concerns from the swabs capacity perspective or even the labs perspective. So we are hoping that it will continue to stay that way.
And just in terms of personal protective equipment, if people are going to their primary care physicians and offices more often for testing, are you worried about that supply in our area?
Well, I think every primary care providers, if they are open and providing services, they are acquiring their own personal protective equipment. From a personal perspective, if someone is going to visit their primary care providers, I think there are specific guidelines that you call in advance. You wear a cloth mask. You stay in the car and call your primary care provider instead of sitting and waiting in the waiting room, and then they can only go inside the clinic once they are called. The number of people who are attending the clinics that are less now, with more time in between and cleaning in between. So there are a number of measures there, and all those clinics that are open, my understanding is they do have these personal protective equipment available for their staffing perspective. But as an individual, if you are visiting, wear a cloth mask.
Thank you.
Any further questions from Blackburn?
Yeah, I'm just seeing some comments on the Facebook feed. Just to clarify, I have one symptom. What's my next step? What exactly should I be doing?
So if you have one symptoms, your option is you can go to the assessment center and get seen by the staff there at the assessment center. If you have a primary care provider that is open and providing services, you contact them, you go through your symptom list, and then you identify your concerns. You can use some of the new guidelines and ask them if they are testing for COVID or doing a nasopharyngeal swab. If they are, they can do that for you. And those are the ways. And if you need further assistance to get tested or to get seen, I think your best bet would be the assessment center, where they have the staff to go through with everything that you have.
Any further questions from CTV?
I'm good, thank you.
AM 800?
Good, thank you.
Windsorite?
No thanks.
Windsor Star?
No, thanks.
CBC?
No, thank you.
Thank you, everyone.
Thank you.